Hey everyone, this is Tara McDonald, and today I'm going to talk to you about tuberculosis. Tuberculosis is one of the oldest human diseases. It's the leading cause of death worldwide from any single infectious agent, and it is estimated that 15 million people in the United States are infected with TB. TB is an infectious disease that is most often caused by Mycobacterium tuberculosis. This is an airborne disease that most commonly infects the lungs. This is spread through coughing, sneezing, or speaking. After inhalation of M. tuberculosis organism, some are expelled and a small portion make it to the alveoli. This causes the primary infection. Extrapulmonary sites of TB are the lymph nodes, pleura, bones, meninges, peritoneum, pericardium, and urinary tract. These patients may present to you with a productive cough, blood in the sputum, anorexia, fatigue, digestive disturbances, slow weight loss, and lack of stamina. The standard testing for making this diagnosis is the tuberculin skin test. People with previous exposure or infection will have a positive test, but this does not determine if the disease is active or latent. A positive reaction usually occurs within 48 to 72 hours. A induration of 5 millimeters or more is considered a positive test in patients with HIV, recently exposed to active TB, or in transplant patients, or an X-ray indicating healed TB. Induration of 10 millimeters or more is considered a positive test in IV drug users, residents of prisons, nursing homes, homeless shelters, people with certain medical conditions, and foreign-born people from high-risk countries such as Africa, Asia, and Latin America. An induration of 15 millimeters or more is considered positive in all other persons. A chest x-ray is then done to test if their disease is active or not, and from then a sputum culture is done to test for any strands that may be drug resistant. Who are at risk for tuberculosis? Close contacts of a person with active TB, people who have immigrated from areas with high rates of TB, children less than 5 years of age who have a positive TB test, groups with high rates of TB transmission, such as IV drug users, people with HIV, and the homeless, people who live or work in hospitals, homeless shelters, correctional facilities, nursing homes, and residential homes for people with HIV. People with certain medical conditions are also at risk, such as your HIV people, substance abusers, diabetes, severe kidney disease, low body weight, organ transplants, head and neck cancers, treatments with steroids, and treatments for RA or Crohn's disease. 3 questions to ask when working this patient up are: have you ever had a positive TB skin test? This can determine if the patient has had previous exposure or infection. Were you born in the United States? If not, what country are you from? This is important to know if they've come from a country with high rates of tuberculosis. What health problems do you have? This will determine if the patient is immunocompromised and if they're at risk. During the physical exam, you want to concentrate on the respiratory system. You want to auscultate the lungs, and these patients may have bronchi, crackles, wheezing, and bronchial breath sounds. They may also have dullness on percussion. Since TB can be spread throughout the body, you want to check the cardiac system. You're going to auscultate the heart for S1 and S2 and any rubs for any indication of pericarditis. You also want to check the lymph system. You're going to assess for cervical and supraclavicular lymphadenopathy and hilar or mediastinal lymphadenitis. The current minimal treatment for all children and adults is 6 months. The overall goal of therapy is to eliminate all TB from the patient and avoiding drug-resistant problems. The first phase is 2 months of taking INH, RIF, PZA, and EMB daily or 2 to 3 times weekly. The second phase is 4 months of INH and RIF daily or 2 to 3 times weekly. Directly observed therapy is recommended and should be offered to everyone. This should be stressed in those where compliance to the regimen is questioned. Taking medication as directed and taking all the medication is most important. If they fail to comply with treatment, the disease is still active and that person is possibly infecting everyone they come in contact with. Infection control measures such as covering nose and mouth when coughing or sneezing, good hand hygiene. You want to suggest the patient sleep alone and not in a room with others, appropriate ventilation, and no visitors. The patient is considered infectious for 2 to 3 weeks of the initial treatment. These measures help prevent transmission to others. You want to teach these patients when to seek medical attention. This can prevent the patient from declining further and causing more distress. You want to stress this in your patients that are already immunocompromised.